Imagine forgetting where you placed your keys. Not alarming, right? Now imagine forgetting what keys are used for. Good morning, everyone. That small difference between normal forgetfulness and something more serious is where today's conversation begins. Dementia doesn't appear suddenly. According to top neurologists, it gives early signals, but only if we know how to recognize them. What is dementia? Dementia is not a single disease. It's a term used to describe conditions that affect memory, thinking, reasoning, and behavior. While aging increases risk, dementia is not a normal part of growing older. Neurologists stress that early awareness can slow progression and greatly improve quality of life. Memory loss that disrupts daily life is often the earliest and most recognizable warning sign of dementia, and neurologists emphasize that it is very different from normal, age-related forgetfulness. Everyone forgets things occasionally: where they left their phone, the name of an acquaintance, or why they walked into a room. However, dementia-related memory loss is persistent, progressive, and begins to interfere with everyday functioning. A person may repeatedly forget recently learned information, important dates, or events, even after being reminded multiple times. They may ask the same questions again and again, not realizing they have already received an answer, or rely heavily on notes, alarms, or family members for tasks they once managed independently. This type of memory loss often affects short-term memory first. Neurologists explain that individuals may clearly remember events from years ago, but struggle to recall what they ate for breakfast or a conversation from earlier in the day. They may miss appointments, forget to pay bills, or have trouble keeping track of medications. Over time, this can lead to frustration, embarrassment, and withdrawal from social situations, as the person becomes aware that something is wrong but cannot control it. Another concerning aspect is forgetting information that is essential to daily life. This might include difficulty remembering familiar routes, misplacing items in unusual places, such as putting keys in the refrigerator, or forgetting the purpose of common objects. In more advanced stages, individuals may forget the names of close family members or struggle to recognize familiar faces, which can be deeply distressing for both the person affected and their loved ones. Top neurologists stress that this kind of memory loss should never be dismissed as just getting older. While aging can slow recall, it does not erase the ability to function independently. When memory problems begin to interfere with work, relationships, or personal safety, they warrant medical attention. Early evaluation allows doctors to determine the cause, rule out reversible conditions, and, if dementia is present, begin treatment and support as soon as possible. Recognizing memory loss that disrupts daily life is not about creating fear, it is about creating awareness, opening the door to early help, and giving individuals the best possible chance to maintain independence and quality of life for as long as possible. Difficulty planning or solving problems is another early warning sign of dementia that neurologists take very seriously, because it reflects changes in how the brain processes information, makes decisions, and follows logical steps in everyday life. This may first appear in subtle ways. A person who was once organized and detail-oriented may begin to struggle with tasks that require concentration or sequential thinking. Activities such as following a familiar recipe, managing household finances, or keeping track of monthly bills can suddenly feel confusing or overwhelming. Mistakes become more frequent, and tasks take much longer than they used to. One of the most common examples neurologists point to is trouble with numbers. An individual may have difficulty balancing a checkbook, calculating change, or understanding bank statements, skills they previously handled with ease. They might forget to pay bills on time, pay the same bill multiple times, or avoid financial tasks altogether because they feel mentally exhausting. This is not due to carelessness or lack of effort, but rather to changes in brain function that affect attention, working memory, and reasoning. Problem-solving challenges can also show up in everyday decision-making. A person may struggle to adjust when something unexpected happens, such as changing plans or fixing a simple household issue. They may become easily frustrated when a task does not go exactly as planned and find it hard to see. NK of alternative solutions. Multitasking, which requires the brain to juggle information, often becomes especially difficult. Neurologists emphasize that these difficulties are different from normal lapses caused by stress, fatigue, or distraction. While anyone can make occasional mistakes, dementia-related planning problems are persistent and progressively worsen over time. The person may be aware that they are struggling, which can lead to anxiety, irritability, or a loss of confidence. As a result, they may begin to withdraw from responsibilities or rely heavily on others to make decisions for them. Recognizing difficulty with planning or problem-solving as a potential warning sign is crucial, because it often appears early in the course of dementia. When identified promptly, medical professionals can assess the underlying cause, recommend treatments or lifestyle changes, and help individuals and families prepare for the future. Most importantly, early recognition allows people to maintain independence and dignity for as long as possible, reinforcing the message that noticing these changes is not about labeling someone but about offering timely support and care. Confusion with time or place is another early warning sign of dementia that neurologists urge people not to ignore, because it reflects a breakdown in the brain's ability to orient itself to the world. At first, these changes may seem mild or easy to dismiss. A person might forget what day of the week it is or lose track of the date more often than usual. However, unlike normal forgetfulness, this confusion happens repeatedly and does not improve with reminders. Someone may ask what year it is, be surprised by the season, or feel disoriented even in the middle of the day. As dementia begins to affect the brain, the sense of time can become distorted. Individuals may struggle to understand how much time has passed or confuse past events with recent ones. For example, they might believe an event from years ago happened just yesterday, or expect someone who passed away long ago to arrive at any moment. This can lead to distress, anxiety, or frustration, especially when reality does not match what they believe. Confusion with place is equally concerning. A person may get lost while walking or driving on routes they have used for years, such as the way home from work or to a nearby store. They may forget how they arrived at a location or be unable to retrace their steps. In some cases, individuals become disoriented even in familiar environments, like their own neighborhood or home, and may not recognize where they are. This can pose serious safety risks and often leads to a loss of confidence and independence. Neurologists explain that this type of disorientation is not simply absent-mindedness. While healthy individuals may occasionally forget the date or feel briefly confused when tired or stressed, dementia-related confusion is ongoing and progressively worsens. The person may become increasingly reliant on others for reassurance and guidance, asking repeatedly where they are or what is happening. This can be emotionally exhausting for both the individual and their caregivers. Early recognition of confusion with time or place is essential because it often signals changes in areas of the brain responsible for memory and awareness. When identified early, medical professionals can evaluate the cause, rule out other conditions, and begin appropriate treatment or support. More importantly, early intervention allows families to take steps to improve safety, reduce anxiety, and plan for future care. Recognizing these signs is not about taking away independence prematurely, but about protecting well-being and ensuring that individuals receive understanding, patience, and help when they need it most. Changes in language and communication are another important early warning sign of dementia that neurologists frequently highlight because language is deeply connected to memory, reasoning, and thought processes in the early stages. These changes can be subtle and easy to overlook. A person may struggle to find the right words during conversation, pause frequently, or substitute incorrect words without realizing it. For example, they might call everyday objects by the wrong name or describe them vaguely instead of naming them directly, such as saying that thing you write with instead of pen. As dementia progresses, conversations may become increasingly difficult to follow. Individuals might lose their train of thought mid-sentence, repeat the same stories or phrases multiple times, or have trouble understanding what others are saying. Neurologists note that this is not simply nervousness or distraction. It reflects changes in the brain areas responsible for language processing and comprehension. Even familiar conversations can become mentally exhausting, leading the person to speak less or withdraw from social interactions altogether. Another common sign is difficulty following or participating in group conversations. Someone may struggle to keep up when multiple people are speaking, miss social cues, or respond in ways that seem unrelated to the topic. Reading and writing can also be affected. A person who once enjoyed reading books or writing messages may find it hard to follow written text, spell words correctly, or express their thoughts clearly on paper. Emails, text messages, or simple notes may become shorter, confusing, or filled with errors. These communication challenges often lead to frustration, embarrassment, and anxiety. Many individuals are aware that their speech is changing, which can cause them to avoid conversations or social gatherings out of fear of making mistakes. Over time, this withdrawal can increase feelings of isolation and depression, further impacting overall well-being. Neurologists emphasize that these language changes are different from normal aging, where occasional word-finding difficulty may occur but does not consistently interfere with communication. In dementia, language problems are persistent and gradually worsen. Early recognition of these changes is crucial because it allows healthcare professionals to assess cognitive function, identify the underlying cause, and recommend appropriate interventions. Speech therapy, cognitive exercises, and supportive communication strategies can help individuals maintain their ability to express themselves for longer. Most importantly, recognizing changes in language and communication encourages patience, understanding, and early support, helping preserve dignity and meaningful connection in everyday life. Mood, behavior, and personality changes are often among the most emotionally challenging early warning signs of dementia, both for the individual experiencing them and for those around them. Neurologists explain that these changes occur because dementia affects areas of the brain responsible for emotion regulation, judgment, and social behavior in the early stages. The shifts may be subtle. A person who was once calm and confident may become unusually anxious, irritable, or easily upset. Small inconveniences that never bothered them before may now trigger strong emotional reactions, such as anger, fear, or frustration. One common change is increased anxiety or suspicion. Individuals may become fearful in unfamiliar situations, cling more closely to routines, or feel uneasy around new people or environments. Some may develop suspicious thoughts, believing others are stealing from them, lying, or trying to harm them, even when there is no evidence. This can strain relationships and create misunderstandings, especially when loved ones are unaware that these behaviors are linked to neurological changes rather than intentional actions. Depression and withdrawal are also frequent early signs. A person may lose interest in hobbies, social activities, or relationships they once enjoyed. They may spend more time alone, speak less, or appear emotionally flat. Neurologists note that this withdrawal is sometimes a response to the individual's awareness that something is wrong. As tasks and conversations become more difficult, avoiding them can feel like a way to cope with embarrassment or fear of failure. Personality changes can be particularly striking. Someone who was once outgoing may become shy or apathetic, while a previously reserved person may act impulsively or say inappropriate things. There may be a noticeable decline in empathy, patience, or emotional sensitivity toward others. These shifts can be confusing and painful for family members, who may feel as though their loved one is becoming a different person. Neurologists stress that these changes are not simply mood swings or normal reactions to aging or stress. While everyone experiences emotional ups and downs, dementia-related changes are persistent, progressive, and represent a clear departure from the person's lifelong patterns of behavior. Early recognition of mood, behavior, and personality changes is crucial, as it allows healthcare providers to evaluate cognitive health and recommend treatments, counseling, or support strategies. With early intervention, families can learn how to respond with patience and understanding, reduce conflict, and create a supportive environment. Recognizing these changes is not about blaming or labeling, it is about acknowledging that the brain is changing and responding with compassion, care, and timely help. Poor judgment and impaired decision-making are critical early warning signs of dementia that neurologists caution should never be ignored, because they can place individuals at serious personal, financial, and physical risk. These changes often appear gradually and may initially be mistaken for carelessness or stubbornness. A person who once made thoughtful, responsible choices may begin to demonstrate decisions that seem out of character, unsafe, or illogical. For example, they might give away large amounts of money to strangers, fall for scams, make risky financial investments, or neglect basic responsibilities, such as paying rent or utilities. One common sign neurologists observe is reduced awareness of consequences. Individuals may struggle to evaluate risks and benefits, leading to poor choices in everyday situations. They might dress inappropriately for the weather, leave doors unlocked, wander into unsafe areas, or ignore medical advice. In some cases, personal hygiene declines not because the person does not care, but because their brain no longer prioritizes or recognizes the importance of these routines. Wearing dirty clothes, skipping bathing, or failing to groom oneself can be early indicators of impaired judgment. Financial judgment is particularly vulnerable in the early stages of dementia. A person may repeatedly withdraw money, mismanage accounts, or trust people they previously would have questioned. Neurologists stress that increased vulnerability to scams is a major red flag, as dementia affects the brain's ability to detect deception and make sound evaluations. The individual may become overly trusting, impulsive, or unable to recognize when they are being taken advantage of. Decision-making difficulties can also affect social behavior. Someone may say inappropriate things, violate social norms, or act impulsively without realizing the impact of their words or actions. This loss of social judgment can be distressing for family members, as it often represents a clear change from the person's lifelong behavior and values. Importantly, neurologists emphasize that poor judgment related to dementia is not the same as occasional mistakes or differences in opinion. Everyone makes bad decisions from time to time, but dementia-related judgment problems are persistent, progressive, and reflect a decline in cognitive control and reasoning. The person may not recognize that their choices are problematic and may become defensive or confused when confronted. Early recognition of poor judgment and decision-making difficulties is essential. Identifying these changes allows healthcare professionals to assess cognitive health, recommend interventions, and help families put protective measures in place, such as financial safeguards or increased supervision. Most importantly, early awareness helps preserve safety, dignity, and well-being. Recognizing impaired judgment is not about taking away independence unnecessarily. It is about ensuring support is provided before serious harm occurs, allowing individuals to live with greater security and compassion as their needs change.